Kia ora. It's great to be here and be amongst friends and colleagues and some people I haven't yet met, but hope you become both of those by the end of the day. My name's Robyn Shearer. I'm the Chief Executive for Te Poa Te Whakaranui. Our name talks about the pillar of contemplation, of reflective thinking, the notion being that Te Poa Te Whakaranui is the postal pillar for people and practices in the mental health, addiction and disability sectors. And it's quite important to us, our name, about bringing together and uplifting research activity, information development, workforce development. And traditionally, a po, as well as being of immense practical value, was highly symbolic and tried and true representation of mana and resolve. Our role is to put policy into practice and inform policy. We're part of the WISE group. We are funded through the Ministry of Health, and we get to work with everybody, from students, education providers, government agencies, NGOs, DHBs, professional bodies, consumers, family whānau. So it always feels an immense challenge to do what we do with such a large group of people that we really want to influence to be doing this. Evidence-based workforce development, and I really like this definition because this speaks to the work that we are doing around practice and leadership, information and outcomes, and actually getting people to do the right thing in their workplace. And I guess that I've worked around the sector for a long time, and I have a passion for workforce development because sometimes it feels like it gets tagged on the end of things instead of thinking actually when we're deciding what our future is going to be of services, we need to think first of who's going to be there to do it. Our workforce are really critical components. We're in a people trade. We're not in, whilst we have technology at our fingertips, and I went to an e-mental health forum last week to have that discussion, we are still, the feedback that we get from consumers and family is that the values and attitudes of the people they work with are the really most important, critical things for them to feel that they're making progress in their well-being. So in discussing measurement and its relevance to workforce development, that's what I'm here to give you a few messages about in 10 minutes. We've had quite a journey in the mental health and addiction sector of implementing routine outcome measurement, and we're not at the end of this road yet. Trying to strive for the mountain, and some of the reasons it's been important to have a long-term vision is that it does take time, and I know Chai was talking this morning about it taking too long, but actually I think we are speeding up the effectiveness of use of information into day-to-day practice rather than waiting for reports to come out on an annual basis or a 5-year basis. And our role certainly is to provide the leverage points and workforce development opportunities to help us realise a vision of where we want to be. So the Ministry of Health have said we're spending $1 billion on mental health care, but is anyone better off? And we had a collection system that measured inputs only, and we wanted to develop a system of outcome and impact measures. And the ministry decided that measuring outcomes was the way to go, and this work started for us in the early 2000s because it was important to, I guess, have some evidence behind that investment. And we looked at 5 domains: clinical, alcohol and drug, self-rated functioning measures, and Māori. Research was undertaken. Philippa Gaines, who's been a long-standing advocate of this, via a classification outcome study at several district health boards testing different measures. And essentially what we ended up coming up with was choosing HONOS as a family of measures for a national collection to be used in DHBs for the measurement of clinical symptoms. We've got more recently the alcohol and drug outcome measure, which was adopted for community addiction services. Hua Oranga has been developed for Māori. For NGOs, the functioning and self-rated measures are arguably the most important, and we haven't yet got a one measure for the NGO sector. But many are using outcome measures, and that's really important. So we have got a national collection system, and we have got a set of measures. And I guess one of the challenges is, how do we bring that to life for people in their day-to-day practice? How do we match what we're doing in terms of the investment to the numbers of people who are using services? So we know how many people we've got in our workforce. We know how much money goes into our system. We also need to think about how many people are accessing services and whether those services are the right things. And measurement becomes a really critical component of that. We need to be able to say who has been seen by whom and for what outcome. This is a way of demonstrating the investment in services, but it's also a way of demonstrating quality, value, effectiveness. We have a national collection system, and that was important to embed if we're thinking about collecting information, collecting outcome measures at a national level, to have somewhere for it to go. So PRIMED was established, the Program for Integration of Outcome Measurement in Mental Health. And for the first time, we had a single rich source of information and data. So PRIMED is a consumer-centric data collection system, not only collecting outcome data, but the other areas that you see here: legal information, activity, outcomes, diagnosis, and referral details. So we can understand who's been seen by whom, what and where. What we're not sure about is what happens when someone's seen in the interactions between a worker and consumer family whānau. But with the data collected here, we can start to see if anyone is better off. And we're working towards understanding the type of activity that may make a positive difference to people, such as the delivery of psychological therapies. And we're working closely with other countries on this. There is the ability to identify not only consumers who are using our services, but also our workers, and then help us understand what their workforce development needs are by mining the data, by providing information back to our government agencies, to our workers, and really understanding what we're doing and is it hitting the mark. So internationally, we are seen as having a really well-respected system with one collection point, and our job really is now to make the most of that information. Now, PRIMED is quite polarising for people. Some people find it complicated to use, too difficult to get information out of. So we're really working hard to make that happen and trying to support the Ministry of Health with that, and also trying to support stakeholders via good reports and feedback mechanisms to bring it to life so that it can be used in routine practice every day. And if done right, it can tell a story about how effective we are being. It's got to be useful. And I guess I was really challenged by the whole idea of outcome measurement. So I've worked clinically in services and managed services and worked at the Ministry of Health, and I didn't really get it. But what I do get now is the ability for us to really understand what we're doing, to use evidence that informs our practice, and you've heard a lot about that this morning. We are absolutely accountable for that to consumers, to our communities, to our whānau. It's really important we're accountable for what we do. We have an obligation. All of our workers do as well. But the measurement is one part of the process. Measurement tools are one part of the process. What is critically important is our engagement. And I guess what we've learnt over the journey that we've been working on implementation of outcome measures with our workforce is really they have to have good engagement with consumers and family before you can have a discussion about what outcomes you want to achieve. And that process needs to be a co-produced process. It isn't about a practitioner sitting alone in a room filling out a form and then producing that to go into a national data set or a data collection system. It's about sitting down, working through that with consumers, with family, so you all are achieving the goals together. But you can also see change over a period of time. And we actually have the ability to get that information out now and be producing really good reports on it. So routine outcome measurement is useful for quality improvement, shared decision making, and helping us know whether we're doing the right thing. It supports evidence-based workforce development. We don't want this. And I guess some of the criticism about outcome measures, about primed, about having systems, is that they don't feel useful, that people feel they're entering information into a system and it goes into a black hole. And it's really important for us to make sure that information is accessible for everyone who's working in our system or who's using our system. So we, I guess, are all working towards achieving a vision, and certainly in the mental health and addiction sector we've had Rising to the Challenge, which is a plan of where we want to be. The challenge is meeting the 100 challenges and actions and rising to the challenge. My view is we need really good tactics to be able to meet these plans, and we also need to ask ourselves, is anyone better off? So a national plan describes the future state, the outcomes of where we expect to be and what we want to achieve. And it then needs to be populated by a number of approaches and data gathering, not only outcomes data, but workforce data, population data, but also people's personal stories and experience of what works for them. It all constitutes evidence. And we need to be connecting the dots between the long-term vision and the tactics to realise the vision, and review points of how things are working, not just at an individual level, but at a team level, a service level, regionally, nationally. We're not that big. We should be able to do this. By using measurement, it helps us understand need. By using validated measurement tools and then looking at trends, we can make some predictions about the future, about future service models, workforce needs and supports. And we need to make that understandable to everybody. Another issue that I've been really concerned about is the use of evaluation, and that's a topic of today. But and our speakers have ably spoken about this morning, but we need to have evaluation to know what we should stop doing and what we should do more of. And if we don't have the evidence, let's gather it, let's grow it, let's review it, and do that on a regular basis. Oh, I wasn't looking at my slides, my apologies. My last slide, what doesn't get measured doesn't get managed. If we don't have a level of accountability, if we're not measuring what we're doing, how do we know we're doing the right thing? And from anyone who's accessing a service, it's really important that they understand that they're going to get the best service that can be delivered. It's based on good evidence. It informs being effective, it's efficient, and it creates better outcomes for consumers and family whānau in our community. Ngā mihi.